Education plays a pivotal role in patients on anti-cancer therapy side effects. We know that the purpose of patient education is to increase the competence and the confidence of patients for self-management in their care. The education process runs parallel to the nursing process. We need to identify learning needs, knowledge deficits, and be prepared to deliver the information differently should the patient not understand on the first try. There are a multitude of factors for barriers to patient education. However, we must overcome these to ensure the patient understands all aspects of his or her care and develop short-term and long-term goals. Oncology nurses are in unique positions to educate on cutaneous adverse events prior to starting therapy to reduce unanticipated side effects and the patient's quality of life. In addition, targeted therapies cause a greater reduction of quality of life than cytotoxic chemotherapies. At baseline evaluation, we perform a total body skin examination and extensively review possible cutaneous side effects prior to starting treatment. A survey that was conducted in cancer survivors showed that people who were receiving chemotherapy have skin side effects that were worse than initially thought in over 2/3 of cases. We want to ensure that these side effects do not come as a surprise to the patients, so they are able to live the best lives possible. The good thing is that these skin reactions are usually temporary, and some may be inversely related to drug efficacy. As one of the most common and anxiety-provoking side effects, educating the patient on the degree, pattern, and timing of hair loss, in addition to the variance in regrowth, is important to discuss prior to treatment. We know that some cancer agents are more linked to hair loss than others, and with the newer types of targeted treatment, hair loss is almost always reversible. The patient should have a conversation with the oncologist and the dermatologist's office to assess the course of hair loss pattern with each therapy and hair care suggestions before, during, and after treatment. When it comes to rashes, we need to educate the patient on the likelihood of developing a rash. For example, between 50 and 90% of patients receiving targeted therapy experience an acne-like rash on the face, scalp, neck, chest, and upper body. Patients need to be aware that it may look like acne, but it is not, and it may become tender, itchy, and dry. Patients also need to be educated on reporting their symptoms upon immediate onset by calling the dermatologist if they have one or their oncologist. There may be different reasons for rashes that may require different treatments, such as allergy, infection, disease-related, drug-induced, and in some cases, psychological. Another important symptom to discuss prior to the start of treatment is the development of hand-foot skin reactions. Because these areas of the body have more blood flow and have faster dividing cells than other parts of the body, the cancer treatment may cause more of an effect on this part of the skin. Activities of daily living and quality of life may be affected at certain stages of grading and may require topical keratolytics, topical steroids, oral nonsteroidal anti-inflammatory medications, topical anesthetics, and topical antibacterials should there be a secondary infection. Upon reaching grade 3 and grade 4, this may result in disruption or discontinuation of the anti-cancer regimen. Other pieces of education to consider are to tell the patients to track their symptoms and take photos, as the symptoms may change over time. Sometimes upon follow-up appointment, the symptoms can look much different than the onset. This will help the healthcare professional and the patient collaboratively work together on a more accurate assessment, diagnosis, and treatment plan. The patient and the caregiver are encouraged to call our office and to take photos of their symptoms throughout the course. We also at MSKCC have a portal system that patients are encouraged to securely communicate through as well. If the patients are trying over-the-counter products, try one product at a time in case of new skin reactions that may occur. This will help determine which product caused the skin irritation or new development of allergies. Some patients even develop allergies to products they have regularly used in the past. When applying multiple topical over-the-counter products and prescriptions, the recommended order for the application starts with the medicated creams, moisturizers, sunscreens, then cosmetics. It is important to apply the topical medication first to ensure best chance of absorption.